For the actual injection, we will run through the steps of how to charge the Puregon pen. This is what you will need for the injection: a Puregon pen, a Puregon cartridge, a needle, some disinfectant, gauze or swabs, and a sharps disposable bin. Puregon cartridges should be stored in a safe place. The refrigerator is a good storage place. Puregon, however, should preferably be administered at room temperature. If you decide to keep it outside the refrigerator, please remember that you can only store it for 3 months at up to a maximum of 25 degrees centigrade. At the start of your Puregon treatment, and each time you need to change a Puregon cartridge, you take the Puregon pen. Remove the cap from the pen by pulling it off gently. Unscrew the body from the cartridge holder and put it aside. For the next step, you need the yellow cartridge holder and a Puregon cartridge. Insert the Puregon cartridge into the yellow cartridge holder. Make sure that the metal cap goes in first. Now screw the body onto the cartridge holder with the cartridge in it. Tighten firmly, but do not over-tighten. Check that there is no space between the body and the cartridge holder. If there is space, screw the cartridge holder towards the body, making sure that the arrow falls within the aligned mark. If there is still a gap left, unscrew the body from the cartridge holder and check whether the cartridge has been inserted correctly. The following steps should be performed every time you use Puregon with the Puregon pen. To reduce the risk of infection, use a new sterile needle for each injection. The cartridge holder must have a cartridge in it before you attach a needle. You can see the cartridge through the windows of the yellow cartridge holder. Clean the end of the Puregon cartridge at the open end of the cartridge holder with a disinfectant swab. Take the needle and remove the protective paper seal. To keep the open needle clean, do not touch the exposed needle or place an open needle unit on the table surface, but proceed directly to the next step. Hold the outer needle shield firmly and push the end of the yellow cartridge holder into the outer needle shield. Screw on securely. Carefully remove the outer needle shield by pulling gently. Leave the inner shield in position. Do not throw away the outer needle shield. You will use it to safely dispose of the needle after the injection. For doses from 50 to 450 IU, turn the dosage knob until the dot next to the required dosage is located between the 2 marks on the dosage scale. If you dial too far by mistake, do not dial the reverse side to correct it, because you will waste fluid. Continue to turn the dosage knob past the 450 mark, as far as it will turn. Completely push in the end of the orange injection button, it slides in very easily, and redial starting from 0 upwards. With this procedure, there is no loss of fluid. After setting the device to the appropriate dose, you are ready to inject. Puregon is designed for injection under the skin. Suitable places for injection include the abdomen or upper leg. Your doctor or nurse will advise the best place for you. Try to vary the site of injection just a little bit each time. Use a swab or piece of gauze moistened with disinfectant to clean the area where the needle will be inserted. Let the disinfectant dry for a moment before proceeding. Pinch the skin a little. With the other hand, insert the needle at an angle of approximately 90 degrees into the skin's surface. Fully press the end of the orange injection button. Wait 5 seconds before removing the needle from the skin. pull out the needle. Gently cover the injection site with a piece of gauze, moistened with disinfectant. Congratulations! You have now successfully administered your Puregon dose. Place the outer needle shield on the table with the opening pointing up. Carefully insert the needle, which is still attached on the pen, into the opening of the shield and push down firmly. Grip the shield and use it to unscrew the needle. Place the needle in the sharps disposable bin to avoid accidental injury. Always take the needle off the pen. Never store the pen with the needle attached, in order to avoid drug leaking and to minimize the risk of contamination. Put the cap back onto the pen and store the pen with the cartridge in it, either in the refrigerator or in a safe place out of the reach of children. Your Puregon pen is already loaded, and all you need to do is attach a new needle. Dial the recorded position on the dosage scale. Inject the prescribed dose. By keeping records of the injections, you can see whether there is enough drug left in the cartridge for your next injection. If you realize before starting the injection that you do not have enough drug in your Puregon cartridge for your dose, you have two options. You can either dispose of that cartridge and change to a new Puregon cartridge and take your dose, or dial the prescribed dose. You can finish the Puregon cartridge which is in the pen, followed by reloading the pen with a new cartridge and taking the remainder of your dose from that new Puregon cartridge. If you realize too late, in other words, after starting the injection, that you do not have enough Puregon in the cartridge, you must also take the remainder of the dose from a new Puregon cartridge. You will see that the dosage scale does not go all the way to 0 after setting and injecting the prescribed dose. The number in the dosage window will not read 0. If you have not injected the complete dose, remove the pen with the needle attached from the skin and then detach the needle from the pen. Write down the position of the arrow on the dosage scale at the point where the pen stopped. This means you are recording how much Puregon is still to be injected. Remove the empty cartridge. Then load a new Puregon cartridge and prepare the pen for injection, as shown previously. Dial the recorded position on the dosage scale. Inject the remainder of the prescribed dose. Before removing the empty cartridge from the pen, the needle must always be removed. Unscrew the body of the pen. Put down the body and remove the empty Puregon cartridge from the cartridge holder and place in the sharps disposable bin. You can now either prepare the pen for loading the next cartridge or reassemble the Puregon pen. If you have any questions about Puregon, write them down and ask your doctor or nurse during your next visit. Treatment of infertility can often be very demanding. Hopefully your treatment with Puregon by the Puregon pen will lead to a successful pregnancy.